This week I'm thinking very much about people with hidden disabilities. I've thought about it a lot over the last few days due to a few things I've seen on Twitter. We had somebody who, I'm born anxious, I've spoken about them a lot, looking at some of their slogans about maybe a parent being sleep deprived, a child who might sort of hit out because of their autism, and also because of another series of tweets about mental health and whether the social emotional mental health category of need, as in the special needs codes of practice, is one for which our children should be on our registers at school. So they got me thinking, and the first thing I thought about is actually well over 25 years ago, when my oldest child was in infant school. There was a mum there who had a badge for her little 4-year-old, and the badge said, "I have autism." Now, the reason she felt she needed that badge was because she was just so fed up with going shopping and her child would have a meltdown, and she'd get all these people going past sort of tut-tut-tutting and "I should look after your child," or "keep your child under control," all this sort of thing, which you really don't need when you're already managing with going shopping with a child who has autism. Now, that was, as I say, over 25 years ago, and it's still something that is needed today. You know, born anxious, their clothing, their bags, they have these sort of slogans that say things like "I have autism" or "I'm anxious", these things that reflect a hidden disability, that by simply looking at the child, their behaviour, the parent, you wouldn't know that that is the reason for what's going on, or you might speak too fast if it's somebody who's got speech and language difficulties, processing and things like that. So these labels are still needed, as in, until society starts to be generally more tolerant and understanding. Tolerant, I don't like that word. That implies that you're putting up with something. More understanding, I think, is the word I really want. You know, society needs, I feel, to consider that you don't know that what you see is exactly what you see. There used to be an advert on television for one of the newspapers where it showed somebody, it looked like they were actually about to mug someone, and what they were actually doing is rescuing someone from being run over. That you only saw part of that story. It actually follows on well from last week when I talk about the nuance behind the tick boxes. This is the nuance behind the behaviour, if you like. Hidden disabilities are just that. They're hidden, they're not obvious, we don't know, we can't make assumptions. A good way of explaining it would actually be to look at something that isn't actually a disability. But I can remember years and years ago, when I was trying to get pregnant with my first child. Since then, fine, I've got 4 sons, you know, no problem getting pregnant. But when I first wanted to have a child, I had difficulty with this. And the hurt when people would say, "Oh, I thought you'd have started a family by now." You know, they don't realise that that morning you just discovered, "No, I'm not pregnant." And that would be hurtful. Now, that's just a throwaway line, and something that a lot of people who don't have special needs of any sort would be able to relate to, you know. So it's about thinking before we speak, thinking before we judge. Why do we pass judgment on people we don't even know? So the child with hidden disabilities, it could be the child who chooses to remain hidden within the classroom, the one who sort of disappears into the background trying not to be seen. That was me when I was at school in terms of reading. I didn't know then that it was because of my dyslexia, but that whole stress of reading around the classroom when you'd count on how many, I've probably said this before, but you'd be working out, everyone reads a paragraph, them, oh, that one's me, 1, 2, 3, 4, right, that one's mine, practice, 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 read it out loud, sound really good when you're reading it, because you've actually spent the last 10 minutes, 15 minutes practicing it, and then, you know, they go on to the next person, your heart's doing this, you're sort of like, breathe, actually you've taken in nothing. So in terms of learning, nothing's happening, but it's a hidden disability. You couldn't tell that by looking at me, and I just read it really well. I read really well in a service or in the classroom. I read really well, but I don't always know what I'm reading unless I've really practiced it first and looked at it several times. So that's a hidden disability. So dyslexia can be a hidden disability. Just rushing somebody to fill out a form when actually they struggle to write their own name, you know, hidden disability. Think about it before you put that pressure on someone. The child hiding in the classroom might be somebody who's autistic, undiagnosed autism, and this happens more with girls, that they try to mask it, so they try to put on some form of act to fit in. That's exhausting. So they're sat there, they're trying to laugh when they see other people laugh, because then that means they're fitting in, even if they don't know why everyone's laughing. Or they try to just hide, disappear, vanish into the back of their seat so they don't get asked to do things. They get home exhausted, they have a major meltdown, and that needs to be recognised, supported. You know, you then ask them the next day, where's your homework? Another meltdown happens because they didn't do their homework the night before because of the previous meltdown, and now the stress is all sort of just compounded, you know. It could be, these are little things I've spoken of, but not collectively as hidden disabilities. You know, I taught a child with CP, cerebral palsy, and what you wouldn't know, there's no way you would know, is he was in constant pain, and he would make jokes and laugh and clown around. That was masking his pain. And so you could be asking him to do, or complaining, oh, why didn't he do that? Because he's in absolute agony. And sometimes a disability, there are all sorts of physical disabilities which you can get by and do things, but to do so is causing you extreme pain, or else you're on medication that's maybe making your head a bit fuzzy or whatever. This is a hidden disability and needs understanding by society. So you've got these categories of need in the Special Educational Needs Code of Practice, and there's one, they've remained constant over the 3 codes of practice, but one of them has changed, and that is one that originally it was emotional behavioural need, then it became behaviour, emotional and social difficulties, and now it's social, emotional, mental health. So you can see there's been a progression. There's this understanding that there are these social needs, there are these mental health needs, these emotional needs. These needs are often hidden. They're not hidden by the one whose behaviour manifests itself by hitting out, by shouting out, by being loud. But then the behaviour might be punished, but the behaviour might be a symptom of something else. It might be a meltdown because this environment is too much. It might be frustration with speech and language needs, where you know in your head what you're trying to say, but the words don't come out. That is incredibly frustrating. I get that on a minor level. You know, I'll be saying, oh, can you give me the I'll say colander. That's the one that used to get me, and I'm really good at it now because it used to get me. Oh, the thing I need for straining the vegetables. But if somebody, when you're trying to think of that word, is going, well, what is it, what are you trying to say? That word just gets further and further away. And that is actually a hidden disability. So these things need, as I say, understanding. Society is developing. We have the sunflower lanyards. You may have seen them in some of the supermarkets and things. And this is a lanyard that basically says, just give me space, or give me time, be patient with me. I've got a hidden disability. Now that could be, I mean, there's all sorts. It could be a health issue. It could be a hearing impairment. It could be visual impairment. It could be a speech and language thing, actually either expressive language, saying it, or receptive language, trying to process what's being said and understand what's being said to you. It could be something such as autism. There's all sorts of things it could be. Some shops and some cinemas have autistic friendly sessions, so They might have slightly dimmer lighting so it's less glary. They might just have a quieter, calmer atmosphere, so that people with these hidden disabilities feel that they can shop with less stress than they would otherwise have. So going back to my original point, all I'm really asking is that we are understanding that we don't necessarily know what's going on. Just because we see some form of behaviour, or just because we notice that somebody is not responding, doesn't mean they're being rude. You know, I worked with somebody who has selective mutism. I worked with her for years, and she could look like she was being just defiant. You know, she'd be, you know, I think the word is dumb insolent. You know, you'd say something to her and she'd just stand there. And it wasn't that she was being rude, she couldn't get those words to come out of her mouth. There was a restriction, a constriction in her throat. She couldn't say them. Not because she didn't want to, but because she had selective mutism, and it could come across in a very different way. So let's be understanding, let's not jump to conclusions, let's not think we know what's going on, let's not assume. Let's say thank you to people like Born Anxious, who give us these t-shirts and sweatshirts and handbags, you know, shopping bags, which have these helpful slogans on them, and the sunflower lanyard and things like that. Let's be thankful for those, let's not jump to conclusions, and let's try to be understanding of those in society who may have a hidden disability. Thank you.